Sperling test is only positive for one thing, and that is reproduction of the patient's familiar cervical radicular symptoms. It can cause pain in a lot of ways. It's a good test. There's a Sperling A and a Sperling B. There's really like 7 versions of Sperling, and as is so often the case, Sperling and Roos, as you'll learn in thoracic outlet, they describe their own tests, of course, back in 1924 or 43 as the very best thing since sliced bread. But it really, there are other tests that I would trust more, but it is a good test. It's in the continuum of cervical compression maneuvers. If we can get our answer doing a straight cervical compression, which has the exact same, that's not good English, is it? Has exactly the same indication, and you reproduce their familiar cervical radicular symptoms, you don't need to keep doing stuff unless it's equivocal. They go, maybe, well, I think I might feel it down to here, but I'm not sure. Move to Sperling A. It's still equivocal, move to Sperling B. But once you get your answer, you don't have to keep hurting your patient. In fact, one of the things at my station on Part 4, it was a series of tests. Did the candidate stop after Sperling A? There was this compression, Sperling A, and then they were to do Sperling B. Their rubric for Sperling B was, did they stop after Sperling A? Why? Because the sim patient had a ragingly positive Sperling A. So, to do Sperling B was just cruel. So, you get your answer, you stop. You'll find that the more you learn about this stuff, the less stuff you do. So anyway, Sperling thinks his thing is the best, most important diagnostic test, blah, blah, blah. I like to just give, this came from Sperling, and so that's why I show it to you, but there's like 7 variations of it. And now Sperling A, this is what I want you to know. Sperling A was also on the boards one time as the Jackson's compression test, aka Jackson's compression test. And on my slide that you have access to, I give you the reference for it. I think it's Netter. Maybe it was Cipriano, maybe it was both. But anyway, Sperling A is also known as the Jackson's compression test, same test. Sperling B, and I don't have it, I'll show you Sperling A, but Sperling B, I don't even have it on my slide yet. That's known also as the maximum foraminal compression test, or the maximum cervical foraminal compression test. You see maximum and compression, just think Sperling B. So here's why the cervical compression is straight down. Sperling A, very simple. Tilt the head, you always do the unaffected side first. We're going to assume the unaffected side was normal. If they come in to you and they have neck pain and right arm pain extending to the hand, that's radicular, right? So you do the left side, normal. Right side, and you just tilt the head to the side. What I like, it's a passive test. I just kind of like to move the head for the patient, instead of saying, you're going to be standing behind him anyway. Could you please laterally flex your head to the right? Well, they might or might not know what you mean. Okay, whatever. Just do it for them. Take their head, tilt it gently to the side, and say, okay, I'm going to gently push down on top of your head. If this causes you any pain or discomfort, please let me know and I'll stop the test immediately, okay? You say pain or discomfort because a radicular symptom can be tingling, not pain, right? So if they take you literally and it's killing them, they'll tell you. But if you just say pain, but if it's tingling and you've said pain, they might grit their teeth but say, no pain. So you have to, 8th grade level. So Sperling A, can I have somebody to do Sperling A, please? Thank you, Fuzzy. Have a seat here. I've done the cervical compression test. It was negative for cervical radicular symptomatology. I'm moving up a notch. This is a little bit more aggressive. The cervical compression closes those foramina some. No worries, negative test. I've done her pain's in her neck and right arm. Now I'm going to test the affected side, so I'm going to gently tilt her head to the side. I've already told her, let me know if it causes any increased pain or discomfort. So I'm going to tilt her head to the right. You can do it either with one hand or two hands. Even though my photos show one hand, I prefer two hands because you're going to be pushing in this direction. You're going to be axially loading it, not this direction. And if I do it like this, like the photo shows, and I'm right hand dominant, it's just too easy to push that way. So you want to push about 15 pounds of pressure straight down. I'm not going to do it, and I don't want you guys to do it to each other too much. But this compresses those foramina more. That's A. B just adds to this. So she had an equivocal A, let's say. I'm not quite sure if it was positive or not. So B is just 3 parts. And it doesn't matter what order. It's extension, lateral bending like the A, and then rotation to the same side. That's the maximum foraminal compression test. 15 pounds of pressure, and that'll generally light the patient up like a pinball machine. Some sources say turn the other way, but they're wrong. The reason they're wrong is because I'm trying to close those foramina maximally, right? So if I tilt it back, that closes them some. If I tilt it to the side on top of that, closes them more. If I turn it away, I'm opening up some foramina. I'm defeating the purpose of the test. So they're wrong, plumb wrong. So he's Sperling A, and if it helps you to remember it, go into Sperling B, keep them in Sperling A, tilt them back and rotate to the same side, same 15 pounds of pressure, and don't bounce, don't pump. No need to do that. And those are your Sperling tests. So we have about 3 minutes to practice that. I want you to do the A test to the right, and then the B test to the right. The most common mistake I see on B is my students, when they do a beautiful job of A, then on B, they extend, rotate, and then they forget to keep them in extension, so they kind of go back to neutral because they're thinking as they go, and it's understandable. So just remember, keep that extension, lateral bending, and rotation same side. Let's do A and then B.